I'm Bitsy. This is the enema checkoff skill. And so the first thing we would do is start off with our quipe. I would go ahead and check my physician's orders, which is, of course, for the enema to be given to my patient. Check to see if my patient has any allergies, and my patient does not have any allergies. I'm going to go ahead and wash my hands and gather all my supplies while I'm doing that. I'm going to go ahead and identify my patient. I would check by their wristband, make sure that their wristband can verify your name and date of birth. Ask my patient name and date of birth. My patient states. Checking it. Everything is good. I'm going to go ahead and provide for privacy for my patient. Make sure the door is closed, curtain is pulled. And I'm going to go ahead and explain to the patient exactly what it is the physician has ordered and start the skill. So basically, I'm going to go ahead and wash my hands. I'm going to go ahead and put on some gloves. And I'm going to explain to my patient that the physician has ordered a enema to be given. There are different types of enemas, so making sure that I check my physician order to figure out which kind of enema they're wanting. And check to make sure there was no allergies, which my patient did not have. I'm going to go ahead and gather all my supplies, one of which I'm going to have my patient lay on their left lateral side, or I could have them in a Sims position if needed. I'm going to put a draw pad underneath them so that there is no mess. And while I am doing that, I'm going to make sure that I am draping my patient, keeping them covered with privacy. I also can take and cover my patient on the upper part to keep them nice and warm during the procedure. I'm going to get either a bedpan, bedside commode, or make sure that there's a bathroom within a set distance of my patient. Also, I would normally have an IV pole so that I can hang the enema bag for the purposes of gravity. And I'm going to go ahead and open up my supplies. So, when doing this, you would take the soap and put it in here, and with this amount of soap, it'll tell you exactly how much fluids to put in and what temperature. Typically, you want it to be greater than room temperature. It could be between 105 to 110 degrees, and that way it doesn't cause cramping or any kind of abdominal pain for the patient. And with this, I'm going to go ahead and I would lubricate the end of my supply, which it comes lubricated. Once my solution is in the bag, I'm going to go ahead and allow gravity to bring the solution down to get all the air bubbles out. Once it is, I'm going to keep my clamp down kind of towards the patient so that I can control it while the bag is hanging. So now that there's no air in my line, I'm going to go ahead and clamp my tube. I'm going to hang it for purposes of gravity, which I don't have a pole, so it's going to be right here for now. Keeping this nice and lubricated, I would apply pressure on their bottom, pulling up and in towards the umbilical area of the patient, approximately 3 to 4 inches. So once that is in, I'm going to go ahead and unclamp, explaining to my patient to stay calm, take some deep breaths, and try to hold this fluid in as much as possible. If they start to complain, cramp, or tell me that they're having pain, I would go ahead and stop, wait about 30 seconds, and try some more. Once all the fluid has come in, I'm going to go ahead and clamp it off to stop the enema solution. I would dispose of this accordingly, take off my gloves and wash my hands. I would ask them to hold the enema solution in for 15 to 30 minutes, and that way it gives the enema time to actually work its way out and do the best that it can. If the patient is unable to, then I would go ahead and assist them to the bedpan or to the commode. Once my patient is done doing their business, I would go ahead, clean up my mess, use wash rags to clean off the patient, and go ahead and let my patient lay in whatever position is comfortable for them, trying to keep them on their left side. give them their call light, and make sure that their bed rails are in the lowest position, bed rail up if it's ordered. And I would go ahead and document. With the documenting of the enema, I want to address the amount, the color, the consistency of it, the time, and how much solution was actually entered into the patient, and how long that solution was held in the patient before the stool was completed. That's it.